Also new here at 4 o'clock, with community-wide spread of COVID-19 high in our area, many kids are at home sick now with the virus, leaving parents really looking for the best way to care for them. Joining us now with some tips, Dr. Redman, ER Director at Children's Hospital. Is always great to have you here. I was hoping we wouldn't have to talk about this, but here we are,
Yeah, we all were.
Yeah, we all had our fingers crossed. So what do parents do right now? I mean, their kids, they're not sick enough to be hospitalized, but at the same token, I know parents have a lot of questions about, all right, my son or my daughter's at home. What do I need to do to help take care of them and help them get healthy again?
Absolutely, and I think that's one of the key messages is that still, even with this variant, the majority of kids are able to be cared for at home.
Sure.
They have mild to moderate illness that is treated the same way as other viruses, with plenty of rest, fluids, and of course, in this case, quarantining and staying away people who could be susceptible.
I was going to say, it's almost like if they have brothers or sisters, make sure that they stay on the other side of the house, and not go to where, not pop in on their sibling there. And,
yeah,
and see how they're
absolutely.
doing.
You still want to, even within your household, quarantine as best as you can.
Yeah.
Oftentimes that's difficult, of course. And then monitor for symptoms in other family members.
Sure. All right, so at what point then do we need to call you or bring our child to come see you?
And that's the important thing, is that with mild or moderate symptoms, again, care at home is important. Calling your pediatrician and arranging, if you need testing, to get that done on an outpatient basis. If you're looking for tests or mild symptoms, our emergency departments all around town right now are fairly overrun with patients, and there have been long waits, and there have been things that are just not emergency department that we're equipped for. So if you have mild or moderate symptoms, then please try and care for that at home in consultation with your pediatrician. However, if you are having symptoms that are significant, and that would include breathing symptoms, chest pain, mental status changes, just not acting right, then those are obviously the kind of things that you do want to get seen for right away.
It's really some elevated changes, some drastic changes, obviously, is what you're kind of looking for. But otherwise, just keep them relaxed. Like you said, take care of them as you would if they were just home ill that day. I mean, just take care of them and let them rest, and hopefully let their body kind of run its course a little bit.
Exactly.
So what do we need to do then in the meantime then? I mean, as far as preventing, I know, and I'm sure this is going back to those 5 cores, but again, it's really, I mean, you can't pound that home enough right now.
Exactly. So social distancing, masking when around other people, good hand washing, and kind of staying separate. Of course, now we have the added tool of vaccination. That's really important as a community-wide prevention measure for stopping the spread. So getting everyone who's eligible vaccinated is really important.
Because right now is what is 12 and up, I guess, with Pfizer at this point.
Yes.
So, Doctor, thank you very much.
Absolutely,
I know it's been busy. I appreciate you coming by.
Of course.
All right. Thank you very much, Summer. I want to remind everybody real quick, don't forget, if you have a question about your child's health, we can get it answered for you. Just email Lori Tucker at ltucker@wat.com, and then tune in to Channel 6 every Thursday at 4 o'clock to see if we answer your question on air. All right, Summer.